In this video, we'll discuss lesions of the oculomotor vesicles, clinical features, and the other structures involved in the lesions of the oculomotor vesicles. So where are the oculomotor vesicles? Vesicles are the portion of the oculomotor nerve that arise from nucleus to the interpeduncular space. What the lesions of the vesicle cause? The lesions of the vesicle cause ipsilateral oculomotor palsy. So what are the features of oculomotor palsy? 4D: dilated pupil, diplopia, drooping of the lid, ptosis, and downwards and outwards eyeball position. Why downward and outward eyeball? Because of the unopposed action of lateral rectus supplied by the sixth cranial nerve, abducens, and the superior oblique supplied by the trochlear nerve, the fourth cranial nerve. Depending on the involvement of the surrounding structures, there are 4 midbrain syndromes associated with vesicular lesions. They are Benedict Syndrome, Nothnagel Syndrome, Claude Syndrome, and Weber Syndrome. What happens in Benedict Syndrome? Benedict Syndrome involves the oculomotor vesicle and the medial half of the red nucleus. So the injury causes ipsilateral oculomotor palsy and contralateral extrapyramidal signs. Because of the involvement of the red nucleus, there are flapping hand tremors, chorea, and athetosis. Second syndrome is Nothnagel syndrome. In this syndrome, there is involvement of the oculomotor vesicles and the cerebellar peduncle. It causes ipsilateral oculomotor palsy and contralateral cerebellar ataxia. Third syndrome is Claude syndrome. Claude syndrome is a combination of both Nothnagel syndrome and Benedict syndrome. It involves all the 3 structures: the oculomotor vesicles, the red nucleus, and the peduncle. So this screen outline is the structure involving all the 3. Here it is, all the 3 involved with the lesion. So lesion involved injury to the CN3, superior cerebellar peduncle decussation, brainstem stroke from occlusion of a branch of the posterior cerebellar artery. So the clinical features are ipsilateral oculomotor palsy and contralateral cerebellar ataxia and dysdiadochokinesia due to the involvement of the red nucleus and chorea and athetosis. Fourth syndrome is Weber syndrome. In Weber syndrome, there is involvement of the vesicles along with the cerebral peduncles. The anterior lesion that affects the cerebral peduncle causes contralateral hemiparesis and ipsilateral oculomotor palsy. Occlusion of the perforating branches of the posterior cerebral artery causes damage to the corticospinal and corticobulbar tract, and the lesion causes ipsilateral oculomotor nerve palsy and contralateral spastic hemiplegia and positive Babinski due to upper motor neuron lesion.